So when we say PII, Personally Identifiable Information, as per the DPDP Act, what exactly that means? Personally identifiable information is treated uniformly as personal data, which is defined as any data of an individual which is in identifiable format, or any data which is related to that. Okay. Unlike all other laws of Indian Constitution, the DPDP Act 2023 does not officially categorize or distinguish sensitive personal data separately. Why? Because any individual's personal data which is in a sensitive form or which is non-sensitive, totally it has covered under personal data arena. Okay. So even sensitive personal data is also treated like personal data with the same high standards as per the Act. So when we say PII, so there are 5 different identifiers. Okay, there are 5 different categories. So under the DPDP Act, all data is about an identifiable information which is called as personal data. So sensitive personal data, generally we call it under health or biometric details. Okay, that is not specifically defined. So we are going to categorize like direct identifiers, indirect identifiers, which are called as metadata, personal characteristics, financial and professional data, and then health and biometric data. So under direct identifiers, full name, residential address, phone number, email address, passport number, Aadhaar, or any other government ID identification number is going to be captured. And second point, when you say metadata or indirect identifiers, like from the systems where we are going to operate, like IP address, okay, device ID, either laptop or desktop or tab, whatever, from where the data is going to be processed. Advertising ID, browser type and which language we are using, date and time of access, location data, okay, either GPS or Wi-Fi, and then usage data. And third one is personal characteristics. There are inherent demographic attributes of an individual, which is called as, date of birth, gender, marital status, nationality, religion, caste or community. And the fourth one, financial and professional details. Whatever we are going to provide during the transactions. For suppose we have been hospitalized. Okay. When I'm going to pay the hospital discharge bill or hospital admission bill, or in between any sort of services which are going to be provided by the nursing staff or paramedics or other medical fraternity. So this is going to take a place. So bank account number, credit card or debit card details, income or salary information, employment details, tax or PAN information, and transaction or purchase history. Okay. So all these fall under financial and employment related information. So here again you may ask, what is the transaction details or PAN? Here in this context, some of the employees who are working in the hospitals or in the HealthTech industry, HealthTech company, or healthcare facility. So the details of the employees, there all these details are going to come. And the fifth one, it is health related and biometric information. Okay, here medical history and health records of the patients, like you and me and whoever it is, and medications or prescriptions which have been prescribed by the doctors, genetic data, fingerprint and biometric data, okay, and iris and retina scans, and mental health information. If you see 6 into 5, so there are 30 varieties of personal data which is going to be processed, okay, which is going to be processed during the course of time. So all the above data are treated as personal data under the DPDP Act, and whenever people are collecting the data, they are processing the data, they are storing the data, and they're sharing the data, it should be done in a lawful manner, it's in a fair manner, in a transparent manner, and with appropriate security safeguards in the organization. For suppose it's a very big hospital or a very big health tech company or a very big healthcare facility where we are processing or storing or collecting or sharing the data, we need to follow the lawful basis. Hope we are clear till now. So now I would like to give you a brief on what are the key roles in a hospital or in a clinic or in a health tech industry. There are multiple roles will be there, but we are going to discuss the key terminology. Okay, data principle. Any individual like you, me, or whoever is going to provide the data. Okay, for suppose in a hospital case, it's patient, or in a clinical research organization, it's a patient. So patient who is called as an individual who is called as data principal in DPDP Act terminology. And data fiduciary, example, hospital or clinic, where they're collecting the data. Okay? They're collecting our data, your data, all of us. Our data is going to be provided to data fiduciary as a part of the requirement. And the data processor is the diagnostic labs, clinical research organizations, or any laboratories or any IT vendors. Okay, so they are going to process our data. So apart from that, there are other roles like consent manager, where child, if at all child data is being processed, parent need to provide the consent. Okay. For suppose there are orphans where they don't have any father or mother. If it is orphan or a disabled children, for those a guardian. So guardian consent or parent consent is mandatory for child or a kid or a student below 18 years of age. So their consent mechanism will come into picture. So in our current context of the webinar, in the healthcare industry or health tech industry or in hospitals, if any child data is being processed, okay, even if it is in pediatric ward, okay, parent consent is mandatory. You may ask, no, whenever parents are going to come and they are going to take admission in the hospital, obviously they're accompanying them. Till now, there is no mechanism in place. But as per the DPDP Act, going forward, all the healthcare and hospitals, wherever they are going to process the child data, they need to take parent consent mandatorily. Okay, so consent-driven processing will be there, and purpose limitation. I'm collecting some data from you. So, what is the purpose? I should provide details, and then the data collection should be limited to the purpose. So, it's a lawful purpose, purposeful collection of data, and data minimization. Only for which purpose I'm taking, I should take the minimal data. Only the required data need to be collected. Okay? There, data minimization will come into picture. And security safeguards. I'm going to take thousands of patients' data in my hospital. Okay, or for suppose 500 customers' data in my health tech company, where I'm going to collect the data, process the data, then I'm going to store the data, and then wherever it is required, I'm going to share the data. So, what sort of security controls are in place in my organization? Whether security safeguards are going to, provide adequate, controls so that there will not be any data breach or any sort of data loss or data theft. So these are the core principles. Okay. When you say personal health information under DPDP Act, okay, Act regulates how entire data lifecycle is going to be handled in the digital form. So, in the context of personal health information (PHI), in the medical fraternity where we are going to use in hospitals or health tech industry or healthcare facilities, what are the entities which are going to cover under this Act? So, once we know the scope, then it is easy to follow. So, hospitals, clinics, diagnostic centers, pharmaceutical companies, medical device manufacturing companies, CROs, clinical research organizations, health technology companies, health tech platforms, and any software companies where they are having the tools where they are going to utilize the personal data of the patients. Then all these entities will come under this Act. There is no exception. And when we process the data, what are the key obligations for these entities, you may ask? So it's lawful, fair and transparent usage of data, as we discussed, and purpose limitation. For what purpose I'm collecting the data? I need to limit it to that extent only. And data minimization. Collect those details which are required to process the PHA. That's it. I should not take less data and more data. Minimal data which is required to process for this particular activity. And security safeguards. So all sorts of security controls need to be implemented. Okay. And data principal rights. Data principal is a person who is an individual like you and me. We are all patients. In an organization, if you say, apart from patients, any customers or clients, if we are going to process their data, we need to enable the individuals to provide the right to access our own data, to correct our own data, to erase the data, or to provide the consent for withdrawal of the data. So here data means again personal data, which is under our PII, which we have seen earlier, 30 types of data. So every detail is highly valuable and highly risky. So when we collect the data, when we process the data, we should be very cautious, because legally, earlier days, it's not legally viable, legally liable, and nobody can challenge us. But now, once the act has come into picture, when people start implementing in their own organizations, then it is going to be a big havoc. So every organization, every healthcare facility need to adopt all these good practices as per the act. And the last one, breach notification. In case of any personal data breach, okay, my data is lost, my data is theft, or my data is misused, okay, then we need to provide a notification, and then any sort of data breach need to be handled as per the defined processes. Yeah. So this is PHA coverage as per the act, what sort of entities and what are the key obligations we have seen. Now, when we talk about health tech companies or healthcare industry processes, so what sort of process we think? Okay, every interaction with a patient or a consumer, or we say client in business environments, okay, or we are providing our health tech platform to multiple healthcare industry professionals. Okay, so what sort of personal data is going to be processed in these areas? One is patient registration. So as you know very well, either it's a clinic or a hospital, or it is a what do you call health tech company. Patient details are going to be registered. Doctor profiles are going to be seen. Appointment history of a patient, okay, and laboratory reports, medical images, and patient prescriptions, chat conversations, video conversations, video consultations as well, AI generated summaries, payment information, device identifiers, location data, system logs, application logs, API transactions, whatnot, and the list is unlimited. So when we are processing these sort of data, how risky we are. Okay. So what is the scope and applicability for health entities? Okay. And the scope, when I talk, the act, the name, the coined term itself indicates that digital personal data protection. Then you can ask a question. Most currently we are running on paper-based approach, but we are going to digitalize by this month end. So our organization is excluded or it is inclusive? Yes, the act applies to personal health information of an organization where you are collecting the data in digital form, or even if it is collected offline, like any hospital documents or physical charts or whatever it is. But you are going to subsequently digitalize it. No, in the current era, in the current digital era, there are multiple chances of data loss, data theft, document losses during fire. Yeah, high risk areas are there. So in this context, as the global digitalization era has come into a stage where we'll not be able to move further on paper-based approach, when it is going to be digitalized in the short time, then this act is also applicable to that extent. So digital and going to be digitalized data. So for both the cases, it's applicable. And next, territorial scope. So you may have a doubt. Is it covering only the PHI processed within India? Yes, it is applicable to all the firms where digital personal data is being collected. It covers PHI processed within India as well as data processed outside India if it is involving healthcare goods or healthcare services to individuals located within India. Okay. And the next point is no exemption for health data. So unlike US based HIPAA, okay, which has specialized rules specifically for health data, DPDP Act is a blanket law. So it has not mentioned specifically. So healthcare providers and entities handling PHA are considered as data fiduciaries. Earlier we have seen data fiduciaries who is going to collect the data. Okay. For suppose healthcare provider, in our case, let us take Apollo Hospital or Medwin or Medicare. So any hospital or health tech company or a healthcare company where they are handling PHA, they are called as data fiduciaries and they are subjected to the same obligations as any other business. Okay. Now we will have a doubt. No, when GST has come, people immediately they have not implemented. So we have seen multiple laws. Even this is also another law. No, as this is directly linked to personal information, the criticality, the intensity, the impact is huge. So definitely every organization or every healthcare facility or every company where large data, volumes of data, big data is going to be handled, there they have to follow this act judiciously without any reservation. So now I would like to give a brief on the global data privacy laws. We are talking about DPDP Act. So in 2023, this has been enacted by Government of India. Okay. Along with the DPDP Act, in 2018, okay, GDPR has come into picture, General Data Protection Regulation in Europe. Okay. In 2020, California CCPA, California Consumer Privacy Act, it has come in USA. Okay. In 2020 itself, in Brazil, LGPD, it has come into picture. Okay. In 2012, in Singapore, PDPA, Personal Data Protection Act, has come into picture. In 2013, South Africa, POPIA, Protection of Personal Information Act. So these are predominantly the key data privacy laws. Almost more than 150 countries have this Privacy Act globally. So no, uh, all the laws are enforced and enforced by the governments, okay, of the respective law of land. So now when we talk DPDP applicability, what are the key obligations for entities handling PHA? Explicit consent. So in our case, let us take you're a doctor, I'm a patient. Okay. So when from the hospital or from the healthcare context or from a health tech company point of view, from that perspective, if you see, we must obtain clear, specific, unambiguous consent from the patient before collecting the data or processing their health data, along with a detailed notice. It's called privacy notice, explaining what data is being processed and why the data is being processed. Second one, purpose limitation. Personal health information can only be used and stored for the specific medical purpose, and the patient originally has given consent to which extent. So the limitation, the purpose need to be limited to that extent only. Okay. The third one is data breach notifications. Healthcare facilities must report any sort of data breach. So data breach, one is data loss, data theft, data misuse, data mishandling. So and data is being used in in a context where there are other commercial benefits where people are misusing it. Okay. So any sort of data breach involving patient medical records to both the affected patients and the Data Protection Board of India. So if any data breach happens, whom we should notify? Okay. So we should first notify to Data Protection Board of India, DPBI. Okay. This has been constituted by Government of India in November 2025. When the DPDP rules have come into picture, then itself a DPBA has been constituted by Government of India. So first they have to report to them. They need to notify to them. Second one, the impacted patient or the affected patient, okay, like all of us. And if any grievances are there, any complaints, patients or data uh, principals are going to log a complaint, then providers must establish an easy to use mechanism for the patients to register the complaints regarding their personal health information. Hope we are clear. Yeah.
Watch the full video on our website. Click the link in the description to get started.